Why are eyes still swelling after 2 weeks from double eyelid surgery? Hi, I had double eyelid surgery 2 weeks ago. The swelling definitely went down since post-op day 1 till today, 2 weeks mark. However, my eyelids are still swollen and the creases are still very high and unnatural looking. My eyelids feel puffy and soft when I gently massage it. Will this be permanent? I'm panicking and depressed. I never step out of my house without shades. Are everything fine with my eyes?
Thank you for your question. You submitted a photo and you have described in your question that it has been 2 weeks since your surgery and you're concerned and panicking about the swelling of your eyelids. Well, I don't think you have any reason at all to panic. It is likely that in your preoperative discussion that the swelling being present at this time is typical. And I'll explain to you how I have this discussion in my practice. We do a lot of Asian eyelid surgery, and I can certainly share with you over 20 years of doing this surgery that there is certainly some degree of variability between patients regarding the amount of swelling they have in a very specific space. You see, Asian eyelid surgery requires a particular type of method that requires the fixation of the eyelid crease to the muscle that lifts the eyelid called the levator muscle. Levator muscle is like the word elevator. It's the muscle that lifts the eyelid. In order to create that crease, there has to be a connection made between the skin and the levator muscle. Now, this can be performed with both an incisional procedure as well as a non-incisional, although a non-incisional procedure does require micro openings, so technically it's not quite that accurate to say non-incisional. Nonetheless, what ends up happening, in my perception, is there is kind of a crowding of a tight space where fluid has a tendency to back up, and that fluid is between the eyelid crease and the eyelid margin, or where the eyelashes are. Now, that swelling can take time to resolve. In fact, that swelling is very often the reason for many patients to panic because they feel like the eyelid crease is too high. So, understanding that this type of swelling at 2 weeks is normal and that swelling can linger and be variable over the course of several months and can go on to even as long as 1 year. Not to the same level, but it is possible. True surgical healing can take up to a year for resolution. So, with that being said, understanding that the swelling that you're experiencing is likely to be normal, and the only things that I advise my patients that might contribute to helping resolve swelling has to do with management of any allergies, particularly eye allergies, a managing of any sinus issues, and of course getting adequate sleep and doing the things that are healthy. And so I would recommend you contact your doctor's office, meet with your doctor. I am certain that as long as your doctor does not feel there is anything abnormal, and judging by that photo that you submitted, it does not appear that there's anything unusual about your situation. Just understand that the body takes its time to heal and that swelling does eventually get better and improve, but it is variable between individuals as to length of time. So I hope that was helpful. I wish you the best of luck. Thank you for your question.